Hi, my name is Rosa Sikote. I am a nurse in the emergency department at Nanyuki Teaching and Referral Hospital. I'm also a lead SIM facilitator at Nanyuki Referral Hospital. In this video, I'm going to take you through how to use a defibrillator. So the objective is identifying a patient who requires defibrillation and how to perform a safe defibrillation on the patient.
This one, we're going to create in a safe space. And what do you mean by safe space? Safe space in the aspect that we have a room to make mistakes, correct our mistakes, improve on our mistakes, without causing any harm to our patient. Because in this scenario, you're going to use a mannequin. And whatever you're going to do will mimic exactly what we are expected to do in a real life situation.
I'm going to introduce to you two lovely ladies who are going to assist me demonstrate to you how to manage a patient in cardiac arrest with the use of a defibrillator. On my right is Jackie and on my left is Emma. John, no response. 1, 2, 3, 4, 5, 6. Help please, patient in cardiac arrest. We need a defibrillator and a BVN mask. I'm starting compressions. 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 8, 9, 10. Yeah, please grab the BVM and support the airway. 26, 27, 28, 29, 30. Please give 2 rescue breaths. Jackie, please take up our contract compressions. Thank you. 1, 2, 3, 4, 5, 6, 7, 8, 9. So Jackie, at some point I'll tell you to take a pause from giving chest compressions. You are going to look, check for the pulse of the patient. At the same time, I'm going to check for the rhythm. When I tell you to resume, you resume immediately. Are we okay? Okay. Jackie, can you please check for a pulse? I'm looking for the rhythm. I have a shockable rhythm. Do we have a pulse?
No pulse rate.
No pulse. Continue CPR. Emma, Jackie, when the monitor is fully charged, I'm going to tell you to step away from the patient with everything, including the oxygen. Is that clear? So charging to 200.
5, 6, 7, 8, 9,
It's charged. Please step away, oxygen, everything. Shock delivered. Continue CPR. So team, we've just delivered the first shock. We have the next 2 minutes to do another pass and rhythm check. So in the meantime, we can start thinking about the H's and the T's. So well done, team. We are now into 2 minutes of our CPR. Jackie will post the compressions. Check for the pulse.
1, 2, 3, 4.
I'm checking for the rhythm. We have a shockable rhythm. Do you have a pulse?
No pulse rate.
Continue CPR. We are going to prepare to shock the patient and also preparing to give the first dose of adrenaline. Defib charge to 360. I'll ask you to step away, oxygen off, step away, shock delivered, continue CPR. Yeah, so team, it's now 2 minutes since we continued the CPR. Jackie, please check for a pulse. I'm looking at the monitor.
1, 2,
we have an unshockable rhythm. Do we have a pulse?
No pulse rate.
So we have a PEA, continue CPR. That was a demonstration on how to manage a cardiac arrest patient. So in the next step, I'm going to demonstrate to you step by step on how we accomplish this. So I've come in, find a patient who is unresponsive, called for his name, there's no response. I checked for signs of life, there's no signs of life. Called for help for someone to bring in a defibrillator and a BVM mask, and at the same time, I'm starting chest compressions. Has arrived. Jackie is doing chest compressions. Winnie is managing the airway. I'm going to connect the monitor to the patient, so I'm putting on the leads.
8, 9, 30.
My machine is on.
5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 6, 7, 8, 9, 20.
Yes, and at this time I'll ask Jackie to stop for a pulse check as I check for the rhythm on the monitor. To ensure high quality CPR is being provided, we are going to make sure that we have minimal interruption. So when we check for the pulse, I'll also be looking at the monitor for the rhythm. Also, by checking for the pulse, we have to ensure that we don't shock a patient who has a pulse.
6, 7, 3, 4, 5, 6.
We have a shockable rhythm. Jackie, do you have a pulse? No pulse, continue CPR.
2, 3, 4,
We have two types of shockable rhythms and two types of non-shockable rhythms. The two shockable rhythms are pulseless, ventricular tachycardia, and ventricular fibrillation. The non-shockable rhythms are the PEA, the pulseless electrical activity, and asystole. Never should you ever shock a non-shockable rhythm. So we've identified that the patient is in cardiac arrest and we have a shockable rhythm. So I will proceed to choosing the energy level that I want to use to shock the patient, and we start with 200. At this time, I'll ask the person who's managing the airway, oxygen, everything off to keep off the patient. And then I'll proceed to charge the defibrillator, and then I'll ask Jackie to stop compressions, step away so that we can deliver the shock. Jackie to step away, deliver the shock, continue CPR. The first priority in managing a patient in a cardiac arrest is to connect the leads on the patient, identify the rhythm. If it's a shockable rhythm, deliver the shock immediately. That was a demonstration on how to manage a patient in cardiac arrests. So what are the key points? First is identification of a patient in cardiac arrest. Once you identify a patient in cardiac arrest, call for help very fast with clear instruction, bring a defib and bring a BVM. Number 3, connect the patient to the defibrillator as soon as possible, check for the rhythm. Once identified that the rhythm is shockable, proceed to shock the patient as soon as possible. Safety measures: once you are charging the defibrillator, make sure that oxygen appliances are away. Once you've charged the defibrillator and want to deliver the shock, make sure that everyone has cleared out and no one is in the proximity to be shocked. We don't want to cause danger. To give high quality CPR by minimizing interruptions to less than 10 seconds. Also, don't ever shock a non-shockable rhythm. Thank you all for watching this amazing video.